Good afternoon. We're here to express the Sheriff's Office profound sadness to let everybody know in our community that Deputy Jeff Hopkins unexpectedly, while off duty, passed away on April 1st from the COVID-19 virus. We were able to get that confirmed early this morning. He took the test late day before yesterday, and it took us a little while to get that answer. Deputy Hopkins was 41 years old. He leaves behind his wife, Wendy, and his mom and dad. Deputy Hopkins has been employed by the El Paso County Sheriff's Office since 2001. He's held a number of different assignments in detentions and in the Law Enforcement Bureau. He was assigned to floor security, to intake and release, the patrol division. He was a defensive tactics and arrest control instructor. You know, it's tough when we have to do this. He was an exceptional employee, and he was always committed. He was always committed to the mission and the vision of the Sheriff's Office, and he will be missed. Public health investigation into his death and into his COVID-19 investigation will take some time. I've got some members of County Health behind me that are going to speak to that. And in the days and weeks ahead, we'll share some additional information. But in the meantime, I'd like to ask the community to keep the Hopkins family in your thoughts and prayers. And now I will ask Susan Whelan to come up and speak.
Aaron, Sheriff. We've honored each victim of the disease in our community. Today we also mourn one of our own, a first responder, a dedicated servant, and a husband and a father. While we don't know how Deputy Jeff Hopkins contracted COVID-19, his death is a reminder of the risk carried by those who serve. We, as a community, thank his family and friends for sharing his life with us. We appreciate all of the sacrifices of every first responder, doctor, nurse, essential personnel, maintenance worker, and each person performing a critical service who work each day as others follow the orders of staying at home. We all honor their sacrifice and dedication. While others have passed away from this disease, given the nature of his service, Deputy Hopkins is the first face and name of the casualties within our community. I urge that his memory and those he has left behind be treated with dignity and respect. As we conduct our time-intensive and thorough epidemiology investigation and information becomes clearer, we, or the Sheriff's Office, will share the appropriate information in the future. The Sheriff's Office and Public Health have a strong history of working together to prevent the spread of disease. We have partnered on issues such as hepatitis A, tuberculosis, influenza, and have been working closely with the Sheriff's Office with the onset of COVID-19 since the activity began early in our community early this year. One of the ways we can safeguard our community is by protecting the health of our law enforcement personnel. Our team is quickly moving to conduct an epidemiological investigation to determine both potential sources of exposures and identify individuals who may have been exposed. Our team works tirelessly to investigate all reported cases of COVID-19. Each day we receive a minimum of 25 cases, requiring an investigation by a public health disease expert or epidemiologist. When a case is reported, our team initiates outreach to investigate the case the same day in which we receive the report. Through interviews and investigations, our team identifies others who may be at risk of infection and notify those individuals. On average, for each case we interview, we identify 10 additional contacts. Today is it's a hard day for all of us, and we emphasize this disease can affect anyone at any age, and including the elderly and vulnerable population, as data shows. But today's chapter of our COVID-19 story is a sobering reminder that the disease can affect anyone, and no one is immune. Our team will work tirelessly to investigate all reported cases of COVID. And as tough as this day is, we will continue to work hard to fulfill our mission of protecting the safety of our community.
Morning. I'm Dr. Johnson, the Medical Director for El Paso County Public Health. These times of crisis reveal our character, and they give us the opportunity to preserve the dignities of those we have lost. As a community, we grieve the loss of Deputy Hopkins and everyone whose life has been impacted by COVID-19. Some have felt that COVID-19 only impacts older people, but with the passing of Deputy Hopkins, it reminds us that none of us are immune. Not a first responder, not a healthcare worker, not the person stocking the shelves at the grocery store, nor our neighbors, our friends, or our family, not even ourselves. We know that our community is resilient, however, and we have faced many difficult challenges in the past. As times of crisis reveal our character, we have the opportunity to show the world the best of ourselves. By staying home and avoiding contact with others if you are experiencing mild symptoms, or suspect that you were exposed, you are helping to prevent the spread of the disease in your home and community. By calling your healthcare provider, if your symptoms become more severe, or using telehealth, you are helping to protect the healthcare workers. By calling 911 only if you're experiencing a medical emergency and sharing your symptoms with the dispatcher, you're helping to protect those first responders. And by staying informed with reliable sources, you are sharing accurate information with your neighbors, friends, and your coworkers. I encourage everyone to visit elpasocountyhealth.org. That's our website. It has information on symptoms you should be looking for as you make decisions to call your healthcare provider. And our website is also compiling a list of resources such as telehealth for those that may not have a healthcare provider. We need to continue to come together as a community to do what is necessary and follow orders to put in place to protect ourselves, families, neighbors, first responders, and healthcare workers. The small sacrifices we make each day can help save a life. Please know that your public health professionals are hard at work addressing the situation and taking the steps necessary to fight this virus. We salute those standing on the front lines caring for our community, and we consider each of you to be our public health partners. Thank you.
Dr. Leon Kelly, I'm the Deputy Medical Director for the El Paso County Public Health Department. The Public Health Department has worked side by side with our sheriff as well as our other local law enforcement agencies from the beginning of this outbreak to ensure not only the safety of our deputies, but to work towards the safety of the folks that they are in care of, which are the inmates and the arrestees. From the beginning, we have worked diligently to prevent the kinds of tragic losses that we're here to talk about today. But as we've done that, we have acted to either meet or exceed all known standards through either the CDC, State Public Health Department, or other recommendations. And as we've done that, we have faced challenges, as all communities have. But this death is a reminder of even the best plans sometimes have challenges when we're facing something like this. And it is also a stark reminder that we must be as resilient and persistent as the virus itself in our efforts. And we will continue to work with our local law enforcement agencies, along with State Public Health Department, as well as other partners like UC Health, to be as aggressive as we possibly can in our efforts to protect our law enforcement officers as well as the community that they serve.
Thanks, everybody. Like they've said, we started preparing our response back as early as the 11th of March. Starting on the 15th, we put together some pretty robust plans and processes in place, began some aggressive disinfecting of the building and patrol cars, and we're down to the point now where everybody that comes in any one of our buildings, we take their temperature and ask them strategic questions to try and stop the spread of this virus, just so that we didn't have to have these kinds of discussions. And so I appreciate our partnerships more than they even know. They've been they're with us every minute of every day, all hours of the night. We've held conference calls. Last night's went until almost 10 o'clock. And so I appreciate what the community's support. And so if there's any questions, Crystal or anyone else?
Right off the top, you might have mentioned this, but what was Deputy Hopkins' position in the last month or so?
The question was, what was Deputy Hopkins' position? His last assignment was an intake and release deputy in the jail.
And this might be a better question for one of the health professionals, but do we know, and we might not have the answer yet, if he had any underlying conditions that might have contributed to his death?
We're not aware of any underlying health conditions. More will come from our investigation. Thank you.
Another question that might go to one of the health professionals. How quickly did this happen? I think that's probably a lot of the public's concern, how quickly this can take effect and then lead to probably the worst possible outcome.
In this case, he had been having symptoms for about 7 to 10 days is our understanding, and again, that will be more clear as our investigation moves forward. We do know that the course of this disease typically has a little bit of a waxing and waning, meaning it'll surge a little bit, you feel worse, you start to feel a little bit better, the next morning you might wake up and go, oh man, it's worse again. And so, again, I'd urge individuals to really look at that website around some of those symptoms that may be kind of signals that it's time to call your healthcare professional and have a conversation.
Sheriff Elder, has there been a determination of how many people the deputy might have come into contact with? Obviously his family, anyone with the sheriff's office?
Yeah, well, we're still working on that. That's part of that epidemiology investigation that the county health will help us with. We've got a rough count. There's probably 40 deputies or so that work in intake and release on all shifts. There's probably another 25 to 30 civilian employees that work in the same area. And so we would expect that he would have had some contact. He had not worked a lot of days in that in the interim period, and especially over the last couple of weeks. He had taken some time off, which has limited some of that exposure. And like I said, we have encouraged people since mid-March that if they're sick, to stay home. And we've put in place a lot of opportunities for people to work from home. Almost every position in the agency that can work from home is being asked to do that. We've eliminated face-to-face briefings. They brief on the fly. And patrol, we're doing it now. We're doing it by WebEx. And so we're doing a whole lot of things. We've got cleaning stations. We've got masks. We've got cleaning supplies, disinfectants and everything available. And we've had that since the beginning. And so we've tried to limit that exposure to as many employees as we can.
Last two questions for you. You know, undergoing any sort of circumstance where we lose a deputy, can you speak to how the department's doing, how his family's doing?
You know, I had a conversation last night with his wife, and you know, it's just these are tough. This is especially in a situation like this. You know, we started the communication piece last night. There were a number of people that knew that we had someone that was very sick. They didn't know in the beginning who it was, and they certainly didn't know it was COVID, even though the symptoms were close. And so once he passed, we took the time to pause and escort him down from the hospital to the coroner's office. And once that was done, we put out a notice to all of the staff to spread it throughout the agency. And so, you know, it's going to take a little while to trickle out. Just before I came over here, I sent an email to everyone in the agency, and we've got almost 900 employees, so it's going to take a while to filter through that. The difficult part is there were a lot of people that knew that he had passed, But the confirmation of the COVID virus, we didn't get until almost 8:30 this morning. And so we certainly didn't want to have people panic by assuming that it was COVID when it may not have been, because we've had a number of people who've tested that have not been COVID. And so, we want to celebrate the fact that while there are a lot of people sick, out of the 900 people in the agency, we've only had 8 positive lab-confirmed tests. And so, and people are getting better, even the ones that have had that.
Kind of answered my question there, but Deputy Hopkins' death was in addition. I think before today we had 6 deputies. You said now there's 8.
Right, there's 8. We had Deputy Hopkins is one of the 8, and then we had another one yesterday as well. Sure.
I would just like to make a note of thanks. We have one of our healthcare partners here today, Dr. William Plouth. He is the Chief Medical Officer for Centura. And if there are questions that you'd like to address to him, he would be available after the conference. Thank you.
Thank you. I appreciate the support.